Hello class, my name is Megan Gardner and today we'll be talking about oral occlusion. These are the objectives for today's presentation. And first, I want to start off with a few review questions about the topic occlusion and check for prior knowledge. Occlusion is the way the teeth meet when the lower jaw or mandible meet the upper jaw or maxilla whenever you bite down. Let's practice identifying some teeth cusps and review our dental anatomy. This cusp is the mesiobuccal cusp of the mandibular first molar. This is the lingual cusp of the mandibular second premolar. And lastly, this is the mesiolingual cusp of the mandibular second molar. A tooth fossa is the normal anatomy of a tooth. It's the shallow, rounded, or angular depression, and we can see that here in the picture. The central fossa is highlighted in this diagram. Some may think that occlusion is only important for aesthetics, but it also plays a huge part in phonetics or speech and our functional chewing and eating our food. We would not be able to enjoy the foods that we eat without our teeth and occlusion. Now let's dive deeper into these two terms, intercuspation and interdigitation. Intercuspation is the cusp to fossa relationship of the upper and lower posterior teeth as they occlude one another. And we can see here in this demonstration the outlined teeth with the black outline. We're looking at the mesiobuccal cusp and the mesiolingual cusp, and some may think that whenever you bite down, these teeth would hit the opposing cusps on the teeth below. This is not really the case. In fact, these teeth will actually go more facially because the maxillary teeth, whenever we close, will end up more facially than the mandibular teeth. And interdigitation is the interlocking or fitting together of the cusps of opposing teeth. And typically we have each tooth interdigitating with the two opposing teeth in that opposite arch. So we can see that here in the photo. Here with this canine, you can see that it is not only occluding with the mandibular canine, but it is also occluding with the tooth behind it. Because this canine occludes with two teeth on the bottom arch instead of one tooth, it really helps provide stability and kind of taking away that occlusal pressure that you feel whenever you bite down. Talking a little bit more about intercuspation, we have these two visuals that give you a better idea. On the left picture, we see the buccal or facial view. So this is if we were to cut the cheek away and look at how the teeth look whenever we're biting down. And you can see that the maxillary teeth are a little bit more facial than the mandibular teeth whenever we bite down. And that allows the lingual cusps to go into this fossa on the mandibular teeth, as you can see here in the lingual view. So this is the tongue, this red thing that I drew, and the maxillary teeth are a little bit more buccal than the mandibular teeth, allowing for these cusps to kind of fit together, and so the cusps don't hit on each other whenever you're biting. Now let's talk about normal occlusion versus malocclusion. So normal occlusion is exactly how it sounds. It's the occlusion that we would like to have and that is ideal. It is all about the molar relationship, and there are three common rules that typically classify somebody with normal occlusion. So the first is the molar relationship. We would like the mesiobuccal cusp of the maxillary first molar to occlude with the buccal groove of the mandibular first molar. And you can see that in that picture with the arrows. That cusp is lining up perfectly with that groove. Secondly, we want the maxillary teeth to overlap the mandibular teeth both buccally and distally. So this is what we were talking about with intercuspation, how the maxillary teeth, whenever you bite down, will overlap the mandibular teeth buccally and distally. And lastly, the proximals of number 8 and 9 and number 24 and 25 will line up in the center of the face and the arch. This just creates a symmetrical look where the midlines are aligned. Now talking about malocclusion. Malocclusion is the abnormal alignment of the upper or lower teeth and how the jaws fit together with one another. And malocclusion can happen just from developmentally, so how your teeth form and develop, or it can occur from any sort of parafunctional habit, such as thumb sucking or tongue thrusting, can actually change the occlusion of your teeth and cause malocclusion. And I included this umbrella because malocclusion is simply an umbrella term for all of these different subtopics of malocclusion that we'll talk about later in this presentation. Now let's get more specific. What are the three major classes of occlusion? They are Class 1, Class 2, and Class 3. Let's talk a little bit about those. Class 1 occlusion is the normal or ideal that we talked about in the previous slide. It is where that mesial buccal cusp of the maxillary first molar is occluding in line to the buccal groove of the mandibular first molar. Now let's talk about Class 2 and Class 3. Class 2 occlusion is where instead of that cusp lining up with the buccal groove, the cusp is going to be found mesial to the buccal groove, and you can see that here with these blue lines. This is oftentimes called overjet, and with Class 3, it is just the opposite. Instead of it being in line with the buccal groove, that cusp is located more distally, and this is oftentimes called underjet. And I remember these terms, overjet and underjet, because the jaws in these instances are either shifted forward or behind one another. And so it kind of reminds me of an airplane. And overjet reminds me if that airplane were to just fly all the way out here, that's what overjet is. And this maxillary jaw is much more anteriorly than the posterior, than the mandibular jaw. Now let's talk about Division 1 and Division 2. These are subcategories within Class 2 occlusion. So when somebody has Class 2 occlusion or overjet, they can either be Division 1 or Division 2. And as we see here in the picture of the models, Division 1 are when the maxillary anterior teeth protrude or buck out. And Division 2 is where these teeth protrude inward or recline in. And now let's go ahead and pull out your diagnostic models and look at them and kind of see these different things that we've gone over on the models themselves. And I'll walk around and help you guys identify the different types of occlusion that we've gone over this far. Alrighty, now that we have talked about what ideal occlusion looks like, let's talk about this photo and what we think this is called. And the this that I'm referring to is these instances where the maxillary teeth are not buccal to the mandibular teeth. So this is called crossbite. And crossbite is present when the maxillary teeth are aligned more lingually to the mandibular teeth. And we know that this goes against one of the rules of ideal occlusion. And now let's talk about open bite. Open bite is an instance where the upper and lower teeth do not meet whenever your jaw is completely closed and biting down. And this can happen in the anterior portion of your mouth or the posterior portion. And this is a really cool Invisalign ClinCheck simulation of an open bite case that was corrected with Invisalign. And though this is not a severe case of open bite, I thought it was cool to include the simulation that Invisalign ClinCheck offers. And last topic under malocclusion is overbite. And overbite is the vertical overlap of the maxillary anterior teeth over the mandibular anterior teeth. And so with overjet and underjet that we talked about with class 2 and class 3 occlusion, that was more of the horizontal overlap, but this with overbite is the vertical overlap. And on the images on the left, you can see that A is classified as normal or slight, B is moderate, and C is obviously very severe because those maxillary anterior teeth are completely covering the mandibular anterior teeth, causing this to be a severe case of overbite. And this is another neat Invisalign ClinCheck where we can see a case of severe overbite being corrected with Invisalign. And now let's go over our review questions. Alrighty, and are there any questions over today's presentation? Thank you guys for watching.